Kidney failure can creep in silently, stealing your health long before you realize it's happening. Every single day, millions of seniors ignore the early signs of kidney failure, thinking it's just stress or aging. But what if those small symptoms you brush off are actually your kidneys crying for help? Each day, your kidneys filter nearly 50 gallons of blood to keep you alive. Yet according to the National Kidney Foundation, more than 37 million Americans already live with chronic kidney disease, and shockingly, 9 out of 10 have no idea. That is why kidney failure is called the silent killer, because the symptoms often hide in plain sight. Today, we're going to uncover the 15 early warning signs of kidney failure that you may be ignoring daily. Recognizing them in time could save your health and even your life. Part 1. Whole body changes, the earliest warnings. Before we dive into the more visible or unusual symptoms of kidney failure, we need to start with what most people feel first, the changes that affect your whole body. These are the signs that are easy to dismiss as just getting older. But in reality, they may be your kidneys sending out their very first cries for help. 1. Fatigue and weakness. Have you ever woken up in the morning after what you thought was a full night's rest, only to feel like a heavy blanket of exhaustion is still weighing you down? You drag yourself out of bed, reach for your second or third cup of coffee before noon, and wonder why even simple daily tasks seem impossible. This is not normal aging. When your kidneys begin to fail, they stop producing enough of a vital hormone called erythropoietin. This hormone tells your bone marrow to make red blood cells. Without it, your body produces fewer red blood cells, which means less oxygen is delivered to your muscles and brain. Over time, this shortage creates chronic fatigue and a deep sense of weakness that no amount of rest can fix. The American Journal of Kidney Diseases reports that up to 60% of patients with chronic kidney disease suffer from anemia. That means more than half of people with kidney problems feel constantly drained, yet they often blame stress or age. But in truth, their blood is literally starving for oxygen. 2. Unexplained shortness of breath. Now imagine climbing the same flight of stairs you've walked up for years, but suddenly you're gasping for air at the top. You pause, your chest feels tight, and you wonder if your heart or lungs are to blame. In many cases, the hidden culprit is your kidneys. There are 2 reasons for this. First, the anemia we just discussed, fewer red blood cells, means less oxygen carried to every cell, so even light activity feels like a marathon. Second, failing kidneys allow fluid to build up in your body. That fluid doesn't just stay in your ankles or legs, it can accumulate inside your lungs, creating what doctors call pulmonary edema. When fluid fills the tiny air sacs in your lungs, oxygen can't pass into your bloodstream properly. The result? A suffocating sensation, as if you're drowning from the inside. 3. Nausea, loss of appetite, and vomiting. Think about the last time you suddenly lost interest in food or felt waves of nausea that came and went without any clear cause. For people with kidney disease, this isn't a random stomach bug. It's the direct result of toxins building up in the blood. When kidneys can't filter waste effectively, a condition called uremia develops. These waste products irritate the lining of the stomach and interfere with the brain's appetite centers. The National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, confirms that many patients in the later stages of kidney disease completely lose their desire for food. This toxic burden turns meals once a source of joy and nourishment into something unpleasant and unappealing. 4. Persistent loss of appetite and unintentional weight loss. As this continues, Appetite doesn't just dip for a few days, it disappears over weeks and months. The body begins to waste away, not because the person wants to lose weight, but because the uremic toxins suppress hunger hormones like ghrelin and increase inflammatory signals that tell the brain to stop eating. In the United States, studies estimate that 30 to 40% of patients with end-stage kidney disease suffer from malnutrition. This kind of weight loss is not healthy. It reflects muscle wasting and a dangerous lack of protein and energy. And unfortunately, malnutrition accelerates the decline of kidney function even further, creating a vicious cycle that's hard to break. What you should do. If you ever find yourself feeling unusually tired despite sleeping well, or you notice shortness of breath during activities that never used to bother you, don't ignore it. These are not just signs of aging. Ask your doctor for a blood test that measures serum creatinine and calculates your eGFR, or estimated glomerular filtration rate. These simple numbers tell you how well your kidneys are working. If nausea and loss of appetite are becoming part of your daily life, your doctor may also order a blood urea nitrogen test, BUN. This test measures how much waste is accumulating in your bloodstream, and it's one of the clearest ways to detect uremia early. Part 2. Skin, mouth, and sensory changes. When kidneys begin to fail, the damage is not only felt deep inside your body, it starts to show on the surface. Your skin, your breath, even the way food tastes can become mirrors of what is happening inside your blood. These outward signs are often easier for others to notice than for you yourself, and they are among the most overlooked early warnings of kidney failure. 5. Severe, persistent itching. Imagine a constant, maddening itch that no cream, no scratching, and no antihistamine can relieve. This is not ordinary dry skin or a seasonal allergy. It is a whole-body torment that can make people desperate. Studies published in Clinical Nephrology reveal that up to 90% of patients with advanced kidney disease experience persistent itching. The reason is that waste products like phosphorus, urea, and calcium build up in the blood. Instead of being removed by the kidneys, they circulate through your system and irritate nerve endings in the skin. That is why the itching feels like it comes from inside the body, not from the surface. 6. Dry, flaky, or darkened skin. Your skin often reflects the health of your organs. In kidney disease, skin problems can become one of the most visible signs that something is wrong. When kidneys can no longer balance minerals and activate vitamin D, the skin loses elasticity, becomes dry, and sometimes develops a sallow or darkened tone. The International Journal of Dermatology reports that deficiencies in vitamin D and B vitamins, both common in kidney patients, accelerate the appearance of premature aging in the skin. For many, no amount of lotion or hydration seems to restore the softness they once had. 7. Ammonia-like breath doctors in the United States often look for this classic symptom, uremic breath. When blood urea levels rise, some of that urea is broken down in the mouth and exhaled through the lungs, producing a strong odor that smells like ammonia or metal. Family members may be the first to notice it, describing it as a strange, almost chemical smell on the breath. This sign is so distinctive that many physicians consider it a hallmark of chronic kidney failure. 8. Metallic taste in the mouth. Hand in hand with uremic breath comes a persistent metallic taste. Patients describe it as if every meal tastes like pennies, blood, or aluminum foil. Over time, this makes eating not only unpleasant, but sometimes impossible. Appetite shrinks, food loses all appeal, and weight loss follows quickly. What looks like a small annoyance is in fact a dangerous signal that toxins are circulating freely in your bloodstream. What you should do: if you develop an unrelenting itch that allergy medicine cannot touch, ask your doctor to check your phosphorus and calcium levels. Dry or discolored skin may require tests for vitamin D and parathyroid hormone, PTH, both of which are closely tied to kidney health. And if you notice a metallic taste or ammonia-like breath, request a urine test to check for protein and albumin leakage. These simple checks can reveal whether your kidneys are struggling long before the damage becomes irreversible. Part 3. Urinary changes and swelling kidney disease often whispers at first, but one of the clearest places it speaks is through your urine. Because urine is the direct product of kidney function, even subtle changes can be an early warning that something is not right. Along with that, the way your body holds onto fluid in your face, your feet, and your hands can reveal the silent struggle your kidneys are fighting. 9 changes in urination. Think of urine as your body's daily report card on kidney health. When your kidneys are working properly, urine should be fairly consistent in color, frequency, and texture. But when damage sets in, you may notice changes that should never be ignored. One of the most alarming signs is persistent foamy or bubbly urine. Unlike the temporary foam caused by forceful urination, this foam lingers, and it means protein is leaking into your urine. Healthy kidneys keep protein in the blood where it belongs, but damaged filters allow it to escape. The Clinical Journal of the American Society of Nephrology confirms that proteinuria is one of the earliest and most reliable signs of kidney damage. You might also notice waking up multiple times at night to urinate, a condition known as nocturia. This happens when kidneys lose their ability to concentrate urine, and in some cases, urine may turn pink, cola-colored, or red, signals that blood is present and medical attention is urgently needed. 10. Puffy eyes in the morning. Another sign hides in the mirror. If you regularly wake up with puffy eyes that don't match how well you slept, it may not just be allergies or a late night. Puffy eyes, especially when persistent, can be one of the first visible indicators of kidney trouble. This swelling occurs because of protein loss. When proteins like albumin leak out into the urine, the balance of fluid in your blood is disrupted. Fluid then escapes into tissues, and the thin skin around your eyes shows it most clearly, particularly after lying flat overnight. 11. Swelling in the feet, ankles, and hands. As kidney function declines further, fluid retention often moves beyond the eyes. Shoes begin to feel tighter, socks leave deep imprints around the ankles, and rings may no longer fit. Unlike the mild swelling you might get from eating a salty meal, kidney-related edema does not simply disappear by morning. It tends to worsen over time and can eventually affect the legs, hands, and even the face. In fact, statistics in the United States show that peripheral edema is one of the most common reasons patients first seek medical evaluation and ultimately receive a diagnosis of kidney disease. What may seem like a cosmetic issue is often the body's way of signaling serious fluid imbalance. What you should do: if you notice persistent changes in your urine foam, unusual color, or frequent nighttime urination, ask your doctor for a urinalysis or a microalbumin urine test. These tests detect protein leaks long before other symptoms appear. For ongoing puffiness around the eyes or swelling in the feet and hands, your doctor may order a kidney ultrasound to check for structural damage, along with blood tests for sodium and potassium levels. In the U.S., physicians commonly recommend the albumin to creatinine ratio (ACR) test. This simple urine test can detect kidney injury at its earliest stage, when treatment is most effective. Part 4. Nervous system and muscle changes. Kidney disease doesn't just affect your urine or your energy levels. As it progresses, it begins to interfere with two of the most vital systems in your body, your muscles and your brain. These symptoms can be frightening because they strike at the very core of your independence, the ability to move freely and to think clearly. 12 muscle cramps. Picture yourself sleeping peacefully, when suddenly you are jolted awake by a searing pain in your calf. The muscle tightens like a vice, and no amount of stretching seems to bring relief. Many people dismiss muscle cramps as a result of dehydration or aging, but when they occur frequently and without clear cause, they can point directly to kidney dysfunction. The kidneys are responsible for maintaining a delicate balance of electrolytes, sodium, potassium, calcium, and magnesium. When they fail, this balance collapses. Low calcium levels can trigger painful spasms, while high potassium levels can cause muscles to contract violently. In severe cases, excess potassium in the blood, known as hyperkalemia, can even disrupt the heart's rhythm and become life-threatening. For many patients, these cramps begin in the legs and feet, but can spread to muscles throughout the body. They often strike at night, robbing people of sleep and creating anxiety about when the next attack will come. What may appear to be a minor nuisance is actually a clear sign that the body's chemistry is being thrown dangerously off balance. 13. Brain fog. Equally troubling, though less visible, is the effect kidney disease can have on the brain. People often describe it as brain fog, a frustrating cloud that makes concentration difficult and memory unreliable. You might walk into a room and forget why, read the same sentence over and over without comprehension, or feel as though your mind is wrapped in cotton. This occurs because failing kidneys allow uremic toxins to accumulate in the blood. These toxins are small enough to cross the blood-brain barrier, directly interfering with nerve signaling and brain function. The American Journal of Nephrology has documented that even patients in the early stages of kidney disease show measurable cognitive decline. Over time, this can affect decision-making, learning, and even emotional stability. For older adults, brain fog is especially dangerous because it increases the risk of accidents, confusion with medications, and social withdrawal. It chips away not just at mental sharpness, but also at quality of life. What you should do: if you experience frequent or severe muscle cramps, ask your doctor for a serum electrolyte panel. This simple test measures sodium, potassium, calcium, and magnesium levels, and can reveal whether your cramps are linked to kidney problems. For ongoing issues with memory, focus, or mental clarity, blood tests for urea and creatinine are critical to check for uremia. In some cases, doctors may also recommend brain imaging like an MRI to rule out other causes, but the most important step is to evaluate kidney function. Part 5. Cardiovascular and pain-related signs. The kidneys are not isolated organs. They work hand in hand with your heart and blood vessels, constantly adjusting fluid levels and blood pressure to keep your body in balance. When they fail, the effects ripple outward, straining your heart, raising your blood pressure, and sometimes even creating pain you can feel deep in your back. 14. High blood pressure. That's hard to control. Imagine checking your blood pressure regularly, only to see the numbers creeping higher and higher, even though you're taking your medications faithfully. For many people, this is not just a heart or artery problem. It is a kidney problem in disguise. The relationship between kidneys and blood pressure is two-way. High blood pressure can damage the delicate blood vessels in the kidneys, but kidney disease itself can also drive blood pressure up. When kidneys fail, they lose their ability to excrete excess sodium and water. This causes the volume of fluid in your bloodstream to rise, pushing blood pressure higher. At the same time, diseased kidneys may secrete too much of a hormone called renin, which makes blood vessels tighten. The combination of fluid overload and vessel constriction can send blood pressure spiraling out of control. The Hypertension Journal reports that nearly 85% of people with chronic kidney disease also suffer from high blood pressure. This is why doctors often call hypertension both a cause and a consequence of kidney failure. For older adults, this cycle is particularly dangerous because uncontrolled blood pressure greatly increases the risk of stroke, heart attack, and further kidney decline. 15 back or flank pain. Another signal comes not from lab numbers, but from physical discomfort. Many patients with kidney issues describe a dull, aching pain in the flank region, the area just below the ribs and to the sides of the spine. Sometimes the pain is sharp and severe, especially if stones or obstructions are involved. While back pain is common in older age, kidney-related pain has its own distinct qualities. It tends to be deeper, more persistent, and often one-sided. Causes include kidney stones, infections, blockages in the urinary tract, or inflammation. Left untreated, these conditions can worsen and contribute to progressive kidney damage. What you should do. If your blood pressure is rising despite medication, ask your doctor for specific hormone tests such as renin and aldosterone, along with standard kidney function tests like serum creatinine and urine analysis. This helps determine whether the kidneys themselves are fueling the problem. If you experience persistent flank or back pain, especially when combined with urinary changes, request a kidney and urinary tract ultrasound. In the United States, doctors may also perform a renal artery Doppler ultrasound if they suspect narrowing of the kidney arteries, which can be a hidden cause of resistant high blood pressure. High blood pressure and back pain may not seem like kidney issues at first, but together with the other warning signs we've covered, they paint a clear picture of organs under stress. Recognizing these 15 signs early is not about fear. It's about giving yourself the power of knowledge, the chance to act before it's too late. In the next section, we'll bring everything together and talk about the simple steps you can take to protect your kidneys and preserve your health. You see, kidney failure does not strike overnight. It creeps in slowly, often beginning with small, silent signals fatigue that never seems to lift, swelling that lingers in your feet or face, a strange metallic breath, or changes in the way you urinate. Each of these signs is your body's way of whispering that something is wrong. When several of them appear together, the whispers grow louder. That is the time to act. Do not wait. Do not dismiss these symptoms as just age or stress. If you recognize them in yourself or in someone you love, schedule a medical checkup immediately. Be clear with your doctor. Ask about kidney function. With just 2 simple tests, a blood test for creatinine and eGFR, and a urine test for protein or albumin, you can uncover kidney disease in its earliest stages, when treatment options are still available and highly effective. Knowledge truly is the most powerful weapon you have to protect your health. The earlier you understand what your body is telling you, the greater your chances of slowing or even preventing kidney failure. You have the power to take control of your health journey. So here's my heartfelt request. Share this video. Share it with your spouse, your children, your friends, your community. Because sometimes, one small sign you notice today could save a life tomorrow. And if you found this message valuable, please hit the like button. It tells us that the work we're doing matters. Subscribe to our channel so you don't miss future videos that could protect your health and give you the knowledge to live stronger, wiser, and longer. Your kidneys may be silent, but now you know how to hear their warning cries. Listen to them, act early, and protect the years of life still ahead of you.